I started back in 1987. I went to college and became interested in the mental health field, primarily because I had three really good mentors, and my original mentor was Dr. Les Fricke. And I got into the field of mental health. I was 17 years old. I hold 5 degrees and 3 postgraduate degrees. I started initially by getting an associate's in mental health, and then I went on to University of Texas in San Antonio, got a bachelor's in psychology, got a master's from Texas A&M Corpus Christi, and then went on and got a second master's at Carlos Albizu University, and ultimately a doctorate in clinical and forensic psychology. It's kind of my educational background. In terms of the work itself, I've done many things. I was a tech, a case manager, a primary therapist, a clinical director, a C-suite exec, and then owning facilities, and was a behavioral healthcare consultant. And at the end of a very long career, I had always done intervention work and working with families and working with patients throughout all of my career in some capacity. I also worked for the Department of Corrections for many years because I started to go down a forensic pathway. I did jury research in high class action lawsuits and civil cases. And so at the end of a long career, I thought that maybe I had given the field everything that I had, and was doing some consulting in some of the behavioral healthcare spaces, and got a call from a colleague of mine who does this work out of New York, and he asked me if I wanted to work some cases with him, and I just fell in love with this work. Again, I've always done this work at some level in working with families and working with patients, but I hadn't ever done it this way exclusively, and we worked some cases together, and I just fell in love with the work.
I always knew I wanted to help people, and about 15 years ago I went and got my nursing degree. I started working in forensics. I was the psychiatric nurse at one of the jails. And not only did I have all the mental health patients, but anybody that was detoxing were also on my roster. And that's when I really fell in love with mental health and substance abuse, just helping people through it. From there, I helped build facilities, anything from residential facilities, detoxes. I worked inside of them, helped build them. And again, that's when I really fell in love with not only helping the person, but also helping the family.